This is Susan Luchas with debugyourhealth.com. I've undergone 5 total cavitation surgeries, some of them unsuccessful, and finally successful cavitation surgery. In this video, I want to go over my cavitation surgery checklist so that you can learn what I learned having successful and unsuccessful cavitation surgery. So hopefully you won't make the same mistakes I did, and hopefully you'll have successful cavitation surgery the first time. This cavitation surgery checklist is downloadable. I will put the link to the checklist in the video notes, so check out the video notes. You can download this, you can print it out. There's also an article on cavitation surgery written on the website debugyourhealth.com. I'll put a link to the article as well, so if you'd rather learn by reading instead of by listening, check out the article. I'm also sort of winging this video, so I may say things in the video that aren't covered in the article, or I may miss things, forget things that are in the article that may not be in the video. So you can check out both. Generally, I've found that there's not much information out there about cavitation surgery. When I was having mine and searching, I just couldn't really find much information about it. So hopefully this video and article will help fill that informational hole and help people have successful surgery the first time. Cavitation surgery is a big deal. It's not an easy surgery, it's not a pleasant surgery, and unfortunately a lot of people have cavitation surgery and then still have cavitations, sometimes even worse than the infections were to begin with. And that was the case for me. That's the case for a lot of people I've seen, a lot of friends, family members who've had cavitation surgery. They're just not healing for various reasons, and that's what I'm going to go over here in the checklist. So the checklist covers first finding a practitioner, what to do pre-op, and finally what to do post-op. One more thing before I get into the checklist. I want to say that after successful cavitation surgery, I am so glad I did it. It has been so beneficial for my health. I've solved problems that I didn't even know I had. So examples of that are, I always had ringing in my ears for 30 years since they extracted all 4 of my wisdom teeth and they weren't extracted properly, so I had 4 cavitations. It was amazing to have cavitation surgery and all of a sudden my ears were quiet after 30 years of ringing. It's pretty amazing. I've also always had this sort of draining feeling down the way back of my throat and neck. I never noticed it before until after the surgery, and all of a sudden that's gone, and I'm like, wow, this is what a normal neck and throat feel like. The other thing is I've always had super tight shoulders and neck up in here. Anytime I'm always tight up in here, and after surgery I'm not tight anymore. I'm just relaxed, and wow, it feels so nice. So those are some unexpected benefits from cavitation surgery. I didn't have it for those reasons. I originally had it because I have Lyme disease, as does my whole family, and as part of the Lyme recovery, you want to rid your body of as many chronic infections as you can so that your body can focus on fighting Lyme disease. So that's why I originally had cavitation surgery, but I got not only that benefit, but all these other unbelievable health benefits. Actually, the other one that I forgot to mention is adrenal fatigue and fibromyalgia, chronic fatigue syndrome. I kind of was always tired, always on the border of adrenal fatigue, and now that I've had cavitation surgery, I have a lot more energy, and I can work harder, I can sleep a little bit less, and not get completely exhausted. So that's another benefit that I've experienced from cavitation surgery. So cavitation surgery, definitely worth it, for me at least, and I think I've seen some miraculous cases come out of successful cavitation surgery, but the problem is there's no good protocols out there for how to find the right practitioner pre-op and post-op. So that's what I'm trying to do here. All right, find a practitioner. I'm just going to go through the checklist. Number 1, I have a checklist so you can check off if your practitioner does all of these things. Number one, removes the periodontal membrane. So there's a membrane around the tooth. If you don't remove the membrane, proper blood flow can't get into the area, and often it creates a pocket where infection can hide from the immune system. So you want to make sure that your oral surgeon or your dentist understands that they need to remove that membrane. And this goes both for cavitation surgery and for extracted teeth. You want someone that uses ozone during the procedure. These bacteria are everywhere. They can't see them. You can't see them. You have to use ozone. It's the only thing that can kill the bacteria when they're in there. My practitioner uses ozone. He scrapes and then he uses ozone, and he scrapes and he uses ozone, and then he says he stops. He knows he's gotten to kind of the end of it when the ozone stops bubbling. So that's kind of one of the cues that he uses. So he scrapes, he ozones, he scrapes, he ozones, and he just kind of keeps going and watches and keeps going with the ozone until it stops bubbling. Does PRF or equivalent technique. This is to help with healing. They take your blood, they spin it. There's many other options besides the platelet-rich fibrin. There's other options as well. Basically, they spin it and they pack it in there, and that's to promote the healing process. So I liked PRF. I would recommend it. Does not force the jaw open. Unfortunately, my unsuccessful cavitation surgery, when I was numb, I wasn't apparently opening my jaw wide enough for the practitioner, so they forced it open. And unfortunately, what that does is it can strain the muscles in your jaw. It's extremely painful, and it continues to be painful way after surgery. It's actually very difficult to recover from. I struggled with it, exercises and massaging, and I actually did luckily get over the trismus, but some people never do. So be sure your practitioner understands not to force the jaw open during surgery. Uses ozone injections after the procedure. So our practitioner, when he finishes the surgery, he stitches up with dissolvable stitches, and then he injects about 2 cc's of ozone into the surgery site after he stitched it up. So I recommend that. They also can inject Trameal, which is a homeopathic healing remedy. I did the Trameal as well. I recommend that too, but I think that's sort of optional, a little more optional. Does not drill into the sinuses through the mouth or puncture the sinus membrane. So this is for the uppers. If you have a tooth or a wisdom tooth or any other tooth that's in the uppers, you don't want them drilling, because what happens is sometimes they can go up into the sinus membrane. And once you have a connection between the mouth and the sinus membrane, the bacteria from the mouth get into the sinus, and that's generally a really bad thing. The sinuses become infected. I actually had the whole side of my face infected, my ear, my eye. I mean, that's when you start to go septic. So you really want someone who understands that we don't drill on top, we only drill on the bottom, if even that. Check the reviews on the practitioner online and offline. This one is tough. There's often not many reviews. I like to use Yelp, but there's not always enough reviews. If you read Yelp, you can kind of tell which reviews are real and which ones aren't. I do personally post reviews on Yelp because I think that's really important. So be sure to Google the person and check out any reviews. Okay, pre-op, before you have your cavitation surgery. So that's how to find a practitioner. Now we're going to move into what do you need to be doing once you've found a practitioner. What do you need to be doing pre-op and post-op? So pre-op, an osteopathic or other cranial treatment. Our skull is a 22-piece puzzle, and you want to make sure that those pieces are as optimally aligned as possible, because once they start drilling, or not drilling, hopefully scraping or maybe drilling on the bottom, they're going to release all kinds of viruses and bacteria. They may, in the pressure of scraping and so forth, they may shift some things around. So you want your 22-piece puzzle to be able to move and to be able to deal with that pressure. So I recommend an osteopathic treatment before. Eat well, sleep well, de-stress. These are all extremely important. I know dental surgery is no fun. It is stressful, but breathe, meditate, do something you enjoy. Eat well, sleep, and de-stress. Request days off work. I have trouble with this. You will need days off work. My personal opinion is from the surgery, take about a week off of work. Even if you feel like you can go back after a couple of days, I would rest, I would relax, really try to sleep and de-stress and let your body heal, because if you don't heal, you may have to do it again like I did. 4 grams vitamin C and 10 KIUs vitamin D starting a week before extraction. So this is basically to get your immune system ready for the onslaught of bacteria and viruses that could be released when that cavitation site is opened up. Order drainage remedies. So I believe drainage remedies actually really help me heal. And in the checklist and online I have links to the remedies that I found the most useful in rank order. So the most useful for me was a remedy called Body Mend, and then dental cord, bacteria cord, lymph tone 3, and adrenal terrain. So those were the remedies that I found helped me the most. I tested actually probably about 100 remedies after cavitation surgery, and these were the ones that were consistently testing well and helping me feel better, helping me heal faster. The thing, most people don't understand drainage, and these are mostly homeopathic remedies. Some of them are herbal. Actually, I think these ones here are all actually adrenal terrain has some herbs in it, but the others I believe are mostly homeopathic. The idea is to open the pathways for your body to heal, and that's not really detox. It's really opening the path for blood to flow, for the immune system to get to where it needs to be, for the bacteria and viruses to come out, to be excreted. For your lymph system, sometimes people get clogged up in the neck, or they get clogged up in the lymph area. So that's what that's for. So get those ordered and get them in stock. So then you have your surgery. Hopefully you've got a good practitioner, you're well rested, you're ready for your surgery. Post-op, what do? Swish with ozone water, hydrogen peroxide, salt water, or any other microbial twice a day for the first week. I like to use ozone water. I use the fruit and vegetable washer from Amazon, pretty cheap, easy to just simply ozonate water, swish with it lightly, and spit it out twice a day. Vitamin C, a 30-gram IV drip if possible. If you have a practitioner and the finances to do an IV drip, I think it's worth it right after surgery. I know there are some practitioners that send you directly for an IV drip. If not, then I would do oral liposomal of about 10 grams per day for the first couple days. Body Mend, that drainage remedy that hopefully has been ordered, 5 to 10 drops orally every few hours. So that's immediately what I recommend post-op. And then long-term post-op, I recommend another osteopathic or cranial practitioner treatment, again, to make sure that if anything was sort of torqued or some pressure and it moved your cranial bones, that those get back into alignment and help you drain out the infection and heal. Drainage and detox remedies depend on the person and bacteria. Try all the drainage remedies, order in the pre-op, about 5 to 10 drops twice a day. So what do I mean by try? You can just try them experimentally and see if you think any of them make you feel better. I use muscle testing, a variation on muscle testing. You can check out some of my other videos on YouTube about how to do that. That's how I do it, and that's how I came to this list of which drainage remedies I recommend ordering. The other thing that's actually not on the list that I just realized I need to add is skin brushing. Sometimes skin brushing can be really helpful for dental infections, and specifically the out. So brushing the skin, dry brushing the skin out here around the face and down to the lymph nodes here. So this motion, and sometimes even starting from the back, coming up and around. So these are the motions that I found really helpful after cavitation surgery. And then once you've kind of gone from the neck down, then I kind of like to go do circles on these lymph watersheds right in here. Do circles here with the brush. And I also like to do kind of the, kind of brushing out and brush the arms. So I like to do the whole thing once I've started, but the real main thing is the out and the around, and then the circles on the lymph. Okay, and finally, the most important part of the long-term post-op is ozone injections. And most practitioners, unfortunately, don't do this. And I think it's really something that needs to be part of their protocol. Our practitioner, for example, he will do ozone injections, but you have to request it and you have to make appointments and go into the office to do it. If you request it, he'll do it for you, but it's not part of his post-op. And in fact, I don't know that it's part of any practitioner's post-op, and I think it needs to be. I think it needs to become part of people's standard post-op procedure. So I recommend ozone injections at 1 week, 2 weeks, 3 weeks, 4 weeks, 6 weeks, 8 weeks, 10 weeks, and possibly more depending on the symptoms, person, and testing. So what happens is that even if the practitioner thinks they've gotten all the bacteria and viruses, they may have, but these things you can't see them, so chances are, and they're everywhere, they're in your mouth, they're everywhere, chances are they may crawl back in there, they may come back through the bloodstream, other viruses and bacteria that you may have circulating around may come in. So the idea is to make sure that no large pocket of bacteria or viruses take hold again in that area until it's healed, and hopefully once it's healed, then there's no direct sort of path there, and your immune system can hopefully handle everything from there. So I think even with a good practitioner, even with a good pre-op and a good surgery, I still think these ozone injections are necessary. So 1 week, 2 week, 3 week, so every week for 4 weeks, and then 6, 8, and 10, that's kind of my default recommendation. I personally test, so I draw myself an injection and I test if I still need it, but this is generally what I found that I needed. And after 10 weeks, I found that I didn't really need them anymore, but it is possible that some people may need them even longer than that. I found that going to a practitioner, waiting for the injection, paying for the injection, getting off work was too much of a hassle. I found that it was actually cheaper, faster, and easier to get a medical grade ozone set up at home and do my own injections. So that's actually what I do. You can do that if you're comfortable. If you're not, go to a practitioner and have them do it. I did actually inject my wisdom teeth, so all the way in the back, myself, so it is possible to do them yourself. The other thing about the dosage of the injection, I recommend at least 2 cc's per site. If you can get in more, you can kind of feel it. You can feel when the pressure starts to build up. Sometimes if it's in the upper, you can feel the ozone almost going through your nose and up into your sinus area. That's okay. So you can kind of dose it based on how you're feeling. Our practitioner by default kind of does 2 cc's per shot. When I did mine, I did minimum of 2 cc's, but often I did more like 4 to 6 cc's, depending on how I was feeling, if I was feeling pressure, and things like that. So those are my recommendations for a successful cavitation surgery. I wish you all success and health in your cavitation surgery and in your lives.